okay, so add on top of that, you've got all these CMS regulatory changes, right? So while of course we want to make things more personalized and we want to be able to improve the experience, but we're constantly having to, and which is just is part of it. We're having to react, and a lot of it is reaction to CMS regulatory changes that occur versus like really being able to take a look and instead of reacting, really respond with what's the best experience that we could provide for a member while still meeting these regulatory changes. But that, that we don't always have that luxury really because they're coming and they're coming quick and we have to figure out how to be able to solve for them. And they will not, this will be continuous. And there's going to be more changes that are going to be coming because there are always changes from CMS that are coming. And so for an example around that, and Annie mentioned this earlier, the M3P payment plan, it is a fantastic benefit for Medicare Advantage members to be able to spread out the cost of their copay over payments over the time period of that year that they're enrolled. But that requires communications to them. It requires an entire setup of how those payments work. There is a significant number of communications that are required for part of that. So always looking at what the regulations are and what the need is. And then really, I would just encourage you to look at your existing vendors and to see where you can leverage communications that are already going out to be able to reinforce any of the regulations around communications such as M3P. Interoperability and patient access is continuing to be a area of focus. We have the CMS interoperability and prior authorization final rule, which is going to require quicker turnaround times. One of the things require quicker turnaround times around utilization management. So, how are you handling that? What is your timeliness around that? And I mean, it's these are just a few. These are just a few things. There's many more changes that happen in CMS, and so always looking with the eye of how do we um, turn around and look at this from a member's perspective and how we can communicate in an experience that they're actually going to be able to digest, absorb, and take action on the information that we're providing them. So that hence the intersection between regulatory and member experience. So let's go to the next slide. Okay, so what are some of the things that we're looking at for prioritizing in 2025? So again, that all the regulatory requirements, there's no choice there. You have to be on top of those and you have to be able to meet the timelines, or there are usually pretty significant penalties that are tied to that, right? But then how can you take the understanding of those regulatory requirements and ensure the way that you're communicating them, that you are improving the member experience, right? I mean, put yourself in the individual shoes where we all have healthcare insurance. And so how would we want to be communicated with, or how would our parents or grandparents, want to be communicated with in the experience around taking these regulatory requirements and making them meeting the requirement, but then also meeting the needs of the individual and trying to simplify what is a very complex industry, right? But it is critical because while we live the complexity day in and day out, you know, um, how do we translate that for our members so that it's something that is simple and understandable? And I just challenge all of us to look at how we can improve upon that because it is definitely needed and it's important and it does lead to retention and satisfaction.